This is very interesting case, that is total anomalous pulmonary venous connection, and total anomalous pulmonary vein connection is joining portal vein finally. So infracardiac variety of total anomalous pulmonary venous connection. I am just expanding this image. Just you see, this is a 4-chamber view, apical 4-chamber view, little bit modified because right ventricle comes more into view. You can see this is right atrium, this is right ventricle, so this is left atrium, this is left ventricle. You can see 2 chamber, here the left atrium, and this is the also very close chamber, that is simply just superior to left atrium, because this is the inferior portion, apex is inferior compared to the base of the heart. So this is the inferior chamber, that is left atrium. The superior chamber is, this is pulmonary venous confluence. So all 4 pulmonary veins join together make one chamber, that is called pulmonary venous confluence. From there one vein goes downwards inferiorly and finally joining portal vein. That is why we call it infracardiac, because all pulmonary veins are joining and draining into portal vein, that is going below the level of heart. So infracardiac variety. Now the next image, again you see the same thing. This is the chamber, this is pulmonary venous confluence, and this portion, this left atrium is getting blood from right atrium through ASD. So left atrium is not getting any pulmonary vein connection, so left atrium has to get blood from somewhere, and that is getting from right atrium. This is right atrium, this is right ventricle, this is apical 4-chamber view. In this image, let me this is left atrium, this is left ventricle, right atrium, right ventricle, and this portion is, this is pulmonary venous confluence. This portion is pulmonary venous confluence. So in this image, only this much is given, we are getting this much information. Now the next image, same thing. Next image, same thing. So what we are getting information from here, if you look at this image, 3 tubes are coming from superior portion, that is, this is aorta, this is IVC, and one thing, this is what? This is a straight vein, that is joining portal vein. So this is a straight vein. This is a straight vein joining this portal vein. So whenever you find 3 tubular structure that is coming from superior portion and in the abdomen, in that case one of them is a straight vein, and that is joining portal vein, most scenario portal vein, and finally draining into infravena cava, portal vein. So this is aorta, this is a straight vein, this is IVC. This portion is coming from pulmonary venous confluence. So if you trace this portion in all frames, you will find this portion is joining pulmonary venous confluence. So this is the case of infracardiac variety of total anomalous pulmonary venous connection. Now you see, you can see this is aorta, this is a straight vein, and this is IVC. So whenever you find 3 things, this is aorta, this is a straight vein, this is IVC. So the middle one is the straight vein that is coming from pulmonary venous confluence. You can see this is right and left pulmonary artery, and right and left pulmonary artery. You see the main pulmonary artery is enlarged compared to aorta. So whenever you find total anomalous pulmonary venous connection, then right side is right atrium, right ventricle, and pulmonary artery all are severely dilated in that case. So in this case, you can easily see this is aorta and this is main pulmonary artery. So quite dilated. You can see clearly. This is the left pulmonary artery, and this is very small PDA, patent ductus arteriosus. Flow is reverse and turbulent. You can see the turbulent is why, because it's very low, very size is very small. At the same time, flow is right to left. Flow is from pulmonary artery to aorta. That is why it is blue in color. You can see in this image. This is main pulmonary artery. Again the same thing. Now you can see this is right pulmonary artery branch, this is left pulmonary artery branch, and most lateral one is PDA, patent ductus arteriosus. So whenever you find all branches of main pulmonary artery, the most lateral one, most left-sided structure is patent ductus arteriosus. So this is right pulmonary artery branch, this is left pulmonary artery branch, and this is PDA. This is parasternal short axis view. You can see this right ventricle, this portion is right ventricle severely dilated compared to left ventricle, and left ventricle is D-shaped, indicating raised right ventricular systolic pressure, compressing the left ventricle, indicating very raised right ventricular systolic pressure, almost indicating pulmonary artery hypertension in this case. So this is the case of total anomalous pulmonary venous connection of infracardiac variety. So whenever you find this is right atrium, right ventricle severely dilated, you are finding two chambers. One is this left atrium, and this is pulmonary venous confluence, and that is draining with a straight vein going inferiorly downwards and joining finally portal vein. So in this case, the IVC will be more enlarged compared to SVC, and there is flow obstruction also. Flow obstruction is here where the straight vein is joining the portal vein. You can see the turbulent flow here, this turbulent flow. So that is flow obstruction. So whenever you find flow obstruction, the baby will be more symptomatic and needs early surgical correction, urgent surgical corrections. Same thing, flow obstruction. Now you can see in this image, this moving image, you see this is aorta, this is a straight vein, and this is IVC. So that is the point to know in this image. So whenever simply you see, so this chamber is coming to become this straight vein, you see. So whenever you find this is aorta, this is a straight vein, and this is infra vena cava IVC. So that is the point to remember whenever you find three structures. So in that case, one of them, this one is a straight vein. So this is aorta, this is straight vein, this is IVC. Same thing. You can see this is ASD and flow almost right to left, no left right flow. You can see here. This is ASD. This is right atrium, this is left atrium, flow from right atrium to left atrium, because left atrium is not getting any pulmonary venous connection. So left atrium has to get from right atrium through ASD. ASD must is in this case. So there must be some sort of ASD in this case. ASD must have flow right to left. This is the size of ASD. This is IVC. You can see the IVC, dilated IVC in this case. This is aorta, this is IVC. So whenever you get such kind of case, right atrium enlarged cyanosis, central cyanosis, oxygen saturation not being maintained by the neonate, in that case right atrium try to find out anomalous pulmonary venous connection, because right atrium is severely dilated. Thank you.